Okay, so our project is over the nurse educator. I'm Morgan Thomason.
I'm Savannah Leonard.
Nursing is a broad area of study. Most nurse educators tend to teach in the field of study that they had worked in. Nurses who work for many years tend to get tired of the same old thing and want to change. Often, acute care nurses tend to be amongst those that become educators. The nurse educator is very beneficial to both the students and the professors. Nurses get to slow their pace, and students get insight from an experienced individual.
Okay, for the current status in the United States, overall employment is 56,270. For colleges, professional, or university settings, it's 28,200, which comes to about 0.96%. For junior colleges, it's close to that. It's 20,470, which comes to 2.69%. For technical or trade schools, it's 3,390, which is 2.28%, and for general medical or surgical hospitals, it's 3,010, which is 0.06%. Just in Kentucky, the general employment is 1,690, and the employment per 1,000 jobs is 0.95. The local quotient is 2.24, and an annual wage is $64,400.
In general, the salary range tends to be anywhere from $78,242 to $85,914, or sometimes less, sometimes more. And the nurse educator only gets paid for the months that they actually teach. So during the summer, they have to find a different job or catch up on their studies. The practice setting tends to be universities or other higher education schools, while the population tends to be nursing students aged 18 and older. Some nurse educators also practice in hospitals. Their duties often includes training new staff members, helping update nursing policies, and monitor certificates, among other things.
The education requirements to become a nursing teacher or educator is most places want you to have at least a master's degree just to teach. But most universities will require instructors or professors to have at least a doctoral in the field. And it's also highly valued for you to have prior experience to help your students with things that don't quite come from the textbook. As for the responsibility of a nurse educator, they have to teach students about nursing and prepare the students for real-world situations. Assign work that will help the students remember and use information to help them later on the job, and give students feedback so that they can improve their skills. They also have to have excellent communication skills.
Other responsibilities include the ability to be flexible, creativity, being committed to lifelong learning, strong leadership skills, and the ability to anticipate change and be able to design an effective program. The nurse educator is a leader in many different settings. In the organization, they keep up to date on nursing policies and techniques. In the community, they teach people how to remain healthy and how to prevent illness. In the professional setting, they prepare up-and-coming nurses with skills needed in the profession.
For reimbursement, there is a set salary for everyone on faculty, but your salary can increase based on years of experience, your education level, and where you are. For patient advocacy, there's no direct one-on-one time with patients to advocate, but they teach students to advocate for the patients, teaching student nurses to hear the patients out and share their concerns and thoughts with their doctor.
The organizations that nursing educators are generally a part of include the Professional Nurse Educators Group, the Association for Nursing Professional Development, and Association of Community Health Nursing Educators. Nurse educators are individuals who are very future and learning oriented. They most likely worked hard for years with the goal of teaching in mind. These people tend to be strong leaders. Finding a job as an educator isn't normally hard as long as you meet the proper requirements. It takes a strong individual to be able to teach the next generation of nurses.
Oh.